Knee arthritis. Let's talk about it. So arthritis is inflammation of one or more joints. We will just use this simple definition for now. And one of the causes of joint inflammation is cartilage destruction. So who is prone to arthritis? Women are more likely than men to suffer from arthritis. Also, the incidence increases after age 40. However, injuries, genetics, and medical conditions can cause it to occur earlier.
Signs and symptoms.
So what are the signs and symptoms of knee arthritis? Now, there are a number of them, but of course, you may not experience all of them. It all depends on your individual situation and the severity of your condition. Now, generally speaking, arthritis can be mild, moderate, or severe, so the symptoms and their severity will vary. You may experience pain and difficulty while walking or climbing up and down stairs or ladders. For some, there may not be any pain while they are sitting, but as soon as they stand up, they experience pain. At times, there may be a grinding or locking sensation in the knee. Some people report the knee feels as if it is going to give out and they are going to fall. Sometimes crackling sounds are heard, but it is also quite normal to not have any arthritis and still hear those crackling sounds. Heat and swelling may occur when you have a flare-up of arthritis. Now, a flare-up can occur when you do an amount of physical work that is not typical for you. For example, cleaning around the holiday season.
Mechanisms.
So what is the mechanism of knee arthritis? What can lead to this degeneration of cartilage? So within the knee joint, there is the thigh bone, shin bone, and kneecap, and these are covered by cartilage. There is also a separate piece of cartilage between the thigh bone and the shin bone called the meniscus. Here's the knee joint. Here is the thigh bone and the shin bone and the kneecap within the knee joint, and there's cartilage here, cartilage on this surface, as well as cartilage underneath the kneecap, as you can see here as they turn the kneecap to face you. So the cartilage contributes to lubrication and cushioning of the knee joint when it bends and straightens, as well as when it needs to absorb impact, for example, landing after a jump. Now, in addition to the cartilage, there's also synovial fluid within the joint that also helps with the lubrication. This fluid is described as having the consistency of egg whites. In arthritis, the fluid can lose some of its consistency and become less effective. So again, here's a picture of the knee joint. Again, the thigh bone, that's the shin bone, that's the kneecap. Now, this dark blue right here, that is the synovial fluid. Okay, that also helps with the lubrication of the knee. Now, when the cartilage gets worn away by various mechanisms, the lubrication and cushioning is reduced. This can lead to increased friction, pain, and swelling within the joint. Now, I mentioned the cartilage can be damaged by different mechanisms, so let's briefly discuss a few of them. Obesity. Now, being overweight will lead to additional loading forces on the knee joint, and over time will lead to excessive wear and tear of the cartilage. But additionally, fat cells secrete proteins that increase the overall inflammation in the body, and this may also be a contributing factor to arthritis in overweight people. Injury. An injury or repetitive injuries, for example in athletes, can lead to arthritis. With an injury, the damaged supportive tissues such as the tendons and ligaments can lead to an unstable knee joint. Also, an injury can cause a person to use the leg less than usual due to the pain. The degree of bending and straightening of the leg may also be reduced. This can lead to muscle weakness and stiffness, which can further lead to a weakened and unstable joint. The lack of strength and poor mechanics due to instability can lead to a degeneration of the cartilage and hence arthritis. This is because the muscles, tendons, and ligaments are not doing their fair share of load bearing, and the cartilage is now forced to deal with those excessive forces. This is why after an injury, it is so important to engage in physical rehabilitation as soon as it is safe to do so. Strength and range of motion need to be regained as quickly as possible. Also, an untreated knee can eventually lead to back pain and spinal problems as you develop a new walking pattern to compensate for a painful knee.
Rheumatoid arthritis.
Now let's talk about rheumatoid arthritis. This is an autoimmune condition. This means the body's own immune system attacks its own tissues. In this case, the synovial tissue is attacked. Remember, this membrane produces the synovial fluid, which helps with the lubrication of the knee joint as well as supplies nutrients to the joint. So let's do a refresher. So again, here is the knee joint and the synovial fluid that is encapsulated by the synovial membrane. It is the synovial membrane that is attacked in rheumatoid arthritis, and it becomes inflamed, and then what happens is the products of inflammation then begin to attack the cartilage and break it down. Now again, so when the synovial membrane is attacked, this is a type of inflammation, and certain byproducts are created in this inflammatory process, and these byproducts of inflammation attack the cartilage, break it down, and then it leads to arthritis. Another way in which cartilage can be damaged is by an infection in the knee joint. If the joint becomes infected with bacteria, viruses, or fungus, it may become hot, stiff, and painful. In this case, the joint may need to be drained with a syringe and medication administered to fight the infection. Now, if the joint infection is not treated quickly, it can lead to a permanent damage in cartilage. This here is a picture of how septic arthritis or infection in the knee may look. Here's the same person, of course, normal knee, and now here's that red hot swollen knee due to infective arthritis. Now, if a person has knock knees or bow legs, the outer and inner cartilage respectively can be worn out due to greater forces because of the knee misalignments. And this will be a normal alignment, bow leg and the knock knees. So as you can see here at the knee, there can be misalignments, of course. So when the knees are bowed outward, you tend to get more cartilage wear and tear on the inside. When the knees are bowed inward, then what happens is you are getting more cartilage wear and tear on the outer portion. And it is because of this misalignment and the additional forces that you are more prone to get arthritis.
Investigations.
So how is knee arthritis investigated and diagnosed? The knee x-ray is one of the main investigations, but depending on the severity and nature of your symptoms, medical history and family history, a number of additional tests may be performed to come to a diagnosis. Remember, there may be other conditions other than arthritis that may be causing your joint pains. So an x-ray can show any reduced joint space within the knee that may point to a loss of cartilage. The x-ray may also show the presence of bone spurs and degeneration of the bone just below the cartilage. So this here would be a normal knee x-ray. Then here is the bottom of the thigh bone, top of the shin bone. That space there represents the cartilage. You cannot see cartilage on an x-ray, but rather you will see the space where the cartilage is supposed to be. So this here is a healthy joint space, and this would be a normal knee showing no arthritis. Now if you have arthritis, you can see the difference. You can see there's clearly a reduced joint space all the way through, especially at this point here. And also right there, that would be a bone spur on the knee. So this will be arthritis as seen on a knee x-ray. If the doctor needs to see soft tissue such as muscle, tendons and ligaments in detail, an MRI can be done. This may be done if the person reports the knee is locking or giving out. So here's an MRI of the knee. This is a side view, thigh bone, kneecap, top of the shin bone. And these two dark spots right here, these are ligaments within the knee joint. Over here, that's muscle. Okay, so you can see there's a lot more detail with the soft tissue on the MRI as compared to the x-ray. Of course, if the doctor suspects your knee pain may be due to an underlying medical condition, blood tests may be ordered. Additionally, fluid can be extracted from the joint and sent to a lab for analysis.
Treatments.
So how do we treat knee arthritis? A good starting point for many early and mild cases would be weight loss, physiotherapy, pain medication, and possibly knee bracing for offloading of the knee. Joint supplements such as glucosamine, chondroitin, MSM, and collagen peptides are debatable, but I personally see no harm in you trying them to see what kind of results you get. Omega-3 oils are also anti-inflammatory and can also be added to your regimen. Additionally, underlying conditions such as diabetes and rheumatoid arthritis will need to be properly managed for you to benefit the most from your regimen. Now, injections directly into the knee joint can be done. 3 popular injections are steroid, platelet-rich plasma, and gel injections. The injections are performed within the joint space. Just for you to know, when the injection is done, it actually goes within the joint space of the knee and the drug is administered inside there. The steroid injection can help to reduce inflammation within the joint. Many are mild and moderate cases of arthritis, but it may not be effective in severe or bone-on-bone arthritis. Now, you are not a candidate for this injection if you have uncontrolled diabetes or high blood pressure. So in this case here, this is what we would call bone-on-bone arthritis, right there, right there. So in this case, steroid is highly unlikely to be effective because of the degree of wear and tear. Platelet-rich plasma can be used to regrow cartilage to some degree in some cases. With this method, plasma is extracted from your own blood and injected into the knee. So when it comes to platelet-rich plasma, this is the process. Blood is extracted from your own arm or your own vein. Then it is put into a test tube. It is put into a centrifuge. It is spun down and it separates the red blood cells from the plasma, and it is this section here that is injected into the knee to help with the possibility of cartilage regrowth. Also, a gel or hyaluronan injection made from chicken combs is another option. It aims to replenish the synovial fluid within the knee and increase the lubrication. So if you are allergic to chicken, this may not be for you. Okay, so that gel is actually made from the chicken comb, and the gel aims to replenish the synovial fluid. If you remember that dark blue there, that is a lubricating fluid within the knee joint, and that is what the gel targets. It aims to replenish the synovial fluid within the knee joint. There's also a treatment called nerve ablation. This is a technique where radio frequency is used to shrivel 3 nerves that supply the knee joint. There are nerves around the knee joint, and these transmit pain signals to the brain. The doctor can target 3 spots around the knee and ablate these nerves so that pain signals are no longer sent to the brain. And this will offer relief for about a year. When those nerves are shriveled, the pain signals from the knee don't reach the brain. This gives the person time to lose weight and perform therapy. The process does not completely kill the nerves, so it may need to be repeated in 1 year if the knee pain has not been resolved in that time frame. It will take about a year for the nerves to regain function to the point where they are transmitting pain signals to the brain again. Then of course there's knee replacement surgery. Typically the lifespan of a knee replacement is 15 to 20 years, after which a revision needs to be done. The knee replacement, that's this device here, but a knee with a lot of arthritis, and then this part is shaved off. Titanium surface is placed on this side here, as well as sometimes on the shin bone they also put one. It all depends. Here is how it looks on the x-ray. Okay, so that's the knee replacement here as seen on x-ray, front view, and that's a side view. To maximize the effectiveness of a knee replacement, some form of physiotherapy will need to be done after. This also applies to the knee injections as well. Knee injections are most effective if followed by weight loss and therapy. So feel free to contact us for more information. You can even WhatsApp your medical reports and scans to us, and we will advise accordingly.
Call today. Progressive Health Services 7475297 or 3083370.